Everyone, and welcome to my channel. Today's video is a special kind of videos that I'm going to do for the first time, and I'm very grateful to tell that I had passed both PLAB 1 and PLAB 2 examination, and I'm very happy to share my story and to help other medical students and other doctors who are willing to do such exam, and to tell what kind of resources and what is the financial cost that comes with these examinations, and what to do in the future after passing this kind of exam, which I will be discovering myself, and I will share the stories that I have heard from my colleagues. So let's start our video by mentioning what is the PLAB exam. The PLAB exam, it's an exam that shows that you are fit and qualified to work as a doctor in the UK. And this examination tests both sides of your knowledge, which is the theoretical side, which is done with PLAB 1 examination, and the PLAB 2 exam, which actually tests everything related to medicine, from your personality, the way you act with patients, and the way that you show your confidence and knowledge to the examiners and to the patients themselves. So both examination, in the end of them, if you pass them, you show that you are a fit doctor to work in the UK. So let's start by how I had my journey and what happened exactly in the first place, and why did I choose to go to the UK. So actually, in my 6 year of medical school, we had something that is called elective, which is a way to discover and to understand more about medicine worldwide, which is a chance to work in any hospital worldwide and to take experience from different hospitals. And you have to choose your hospital that you're willing to do your elective in smartly, because you have to choose you have to choose the hospital that will fit to your future residency plan. For example, I have chosen to work and train in Chelsea and Westminster Hospital, which is located in London. It's one of the best hospitals worldwide and in London. And this hospital and this kind of experience added a lot to my journey, on the personal side. Also, in the medical side, I had the chance to meet one of the most amazing teams, and it is actually a chance that I'm so grateful that I had, because it is one of the most important contributors in my journey, through this long-term journey, which is the residency journey after graduating. So, as I mentioned, in your 6 year, you have the chance to do an elective, which is doing medical observation in one of the hospitals worldwide. Choose it smartly, choose it in a hospital that fits your references and requirements for residency. And it's worth mentioning that students that are aiming to work in the US, it's a necessity, or it's something that is very important to choose your elective in the US. While in the UK, it adds on, but it's not a necessity or a must to do it in the UK. So the first step in my journey was doing an elective in Chelsea and Westminster Hospital in neurology. It was 2 months elective, and it is, as I mentioned, a very important step to help you to understand more about the residency, to understand more about the UK system and the NHS requirements when you work there. So after doing that and after graduating, I started the PLAB journey. So everyone who's willing to go this journey, he has to go multiple steps. One of the most important steps, and the first step that every student or every medical doctor that should do, is the English examination. And the English exam, there is two choices to show that you have English that is suitable to work in the UK and you can communicate easily with patients. You have two options. The first one, which is the occupational English test, OET. The OET is a test that has 4 subtests, starting by listening, reading, writing, and speaking. And you have to score at least a B, which is over 350 score. After scoring such grades, you have the chance to book the PLAB 1 examination. So the first step, which is doing OET examination, which is an English test with 4 subtests, and it usually costs around 310 pounds. After passing this exam, you are eligible to book your PLAB 1 exam. The PLAB 1 exam is an exam that is usually testing the theoretical part of your knowledge. So it's a multiple choice examination that is held in multiple countries worldwide. For Middle East, for example, it's done in Dubai, it's done in Saudi Arabia, also it's done in Egypt. So students from Middle East usually do it in Dubai. For example, in my case, I have done the exam in August in Dubai, and this exam is held 4 times a year. It is done in February, in May, also in August, and in November. So you have to understand that in the first step, as a medical exam, the theoretical exam is PLAB 1. The PLAB 1 exam usually costs around 3,000 pounds, and it's always depending on your personal references. It sometimes can cost just 870 pounds. It depends on traveling costs and the way you would like to live through the exam. So the first step is PLAB 1. So let's discuss how to prepare for the PLAB 1 and what is the timing and how much you need to study for such exam. So the PLAB 1 exam, as I mentioned, it's an exam that depends on how you show your medical knowledge and the theoretical knowledge in a multiple choice questions. And in such cases, the most recommended and the most common resource for preparing for this exam is Blabbable. The Blabbable is an application that is a kind of similar to the UWorld in the US pathway, which has a question bank. And this question bank depends on the topics that are going to be tested in the exam. So I brought a sheet that shows the topics that are usually asked in this exam. For example, they ask about emergency medicine, pediatrics, psychiatry, cardiology, and also ENT respiratory. So this exam depends on asking questions that related to medicine in a whole package. So you will have questions related to the first 3 medical years, which is the basic knowledge. Also, there will be questions about the final 3 years, which is the clinical knowledge. So you have to be prepared on both sides. The best website in my case, in my journey, I chose Blabbable. And Blabbable showed me a lot of places or questions that I might have some kind of weakness. So I improved a lot by using this kind of Blabbable. Actually, I had about 2 months to prepare for this exam, but I was having my job, so I was not studying that much in the first month, but in the month that is before the exam, I actually studied about 10 hours daily, answering questions, doing the question banks, and finishing all the question banks of Blabbable. And after that, in the final 10 days, I have done about 7 to 10 mocks, which showed that I am scoring well. And that's actually what happened in my exam, because the mocks and the questions are almost similar to the exam and the real exam questions. So it's a good choice and it's a reliable choice, and it was good in my journey. So this is my first recommendation regarding what to study for PLAB 1. What is the time that is needed for this exam? As I mentioned, it's about 2 months. 1 month with a dedicated studying should be enough for this exam. After 1.5 months of doing my PLAB exam, PLAB 1 exam, I had my result and I scored 145, which is a good result, as I was not preparing as much as others. So I'm happy with this result. And it was the way that I jumped to the next step, which is the more complicated step, which is PLAB 2. So let's start by mentioning that PLAB 2 exam, it is a well-rounded examination which aims to see if you are a real doctor and aims to see if you are able to deal with different situations, with different patients, with different conflicts that you might face in your real life in the hospital. So you have to understand what the exam needs from you. So to be honest, this exam is one of the most difficult exams that I have faced in my life, in my medical life, because it needs to be done in the way that shows how much you know. Because sometimes people they have a lot of knowledge, but they do not know how to show it, and they do not know how to speak it. So this exam needs you to be well prepared to face such situations. The PLAB 2 exam has two sides in the exam. The first side is the medical knowledge side, where you have a patient, you speak with the patient for 8 minutes, and you have to reach a diagnosis and manage the patient according to that. So, doing the PLAB 2 exam, the first part is the medical part. It is a station or sketch station where you have a patient and an examiner, and you have to ask the suitable questions to to reach a proper diagnosis and to treat according to that. The second part is the hands-on part, where you have to do a physical examination on a mannequin. Also, you have to do some kind of procedures. Also, you might need to teach some medical students in some scenarios. Also, sometimes you need to prescribe medications as you are asked in the STEM. So let's start by how I prepared for this exam and what resources I have used. So starting by the timing, I had actually around 40 days to prepare for this exam. But 40 days were a real 40 days because I was only thinking about this exam. I traveled to the UK before my exam date, about 40 days before my exam date, and I choose Dr. Mo Sobhi Academy, which is one of the most successful and one of the largest academy teaching PLAB 2 examination. And I'm very grateful that I have choose this academy because it helped me a lot through this journey. So let's start by what to expect when you reach the academy and what does the academy offer to you and how did the academy help me. So let's start by that Dr. Mo Sobhi Academy helps a lot in choosing the proper way to be prepared to the exam. So when you reach there, after doing the necessary registration, you have a weekly schedule. This schedule is consist of multiple hands-on topics, starting by the Ghalaba MOOC, which is something that is unique for this academy, which is a way to train with your other colleagues to be prepared for the exam. So some cases you act as a doctor, some cases you act as a role play or a simulator, where you test your friend's knowledge and he tests your own knowledge. So you have a kind of positive feedback. You have to show your colleague what kind of weakness he has, and by doing practice in this exam, you always improve. So the first and the most important thing in PLAB 2 exam is how to prepare for the exam. And the first thing that is important in the preparation is practice, 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 and choosing your study partner in a smart way that he improves you and you help him to improve. So Ghalaba MOOC helped me a lot to find my study partners, whom I'm going to show in a minute, and actually the three of us had passed the examination, the PLAB 2 exam, because of the way that we practiced with each other. And each one of us had a strong point and a weak point. So we tried to improve each other. On the other hand, in the second day, we had a procedure session, which usually a kind of taking a blood sample, doing an ABG. Sometimes you might need to put a catheter. So this is the procedure. Also, we have an examination session. In the examination session, we will do some kind of physical exam depending on the case. Sometimes you might get an abdominal examination, a breast examination, testicular examination. So it depends on the case. So this is the examination part. Also, we have the teaching part. The teaching part depends on a scenario where you need to teach a medical student or a nurse about what kind of um, uh, what kind of medical procedure or some kind of medical knowledge they might need. So for example, you might need to teach them a little bit about ECG or different topics depending on the stem of the exam. The final two stations or the final two sessions is the prescription session, where you have to prescribe a medication on according to the UK system, and to write it in the proper way. And finally, the Simman, and the Simman is an abbreviation of Simiman, where you have a Manican, which is a whole human body, and it has an emergency situation where you have to deal as fast as you can to help the patient to regain his consciousness, for example, or to improve his oxygen saturation, depending on the situation or the scenario that you get. So, to recap, PLAB 2 exam has two parts. The theoretical part, where you just take a history and treat according to the diagnosis that you had. The second part is the hands-on part, which is the part that you will need an academy usually. And as I mentioned, in my case, I have chosen Dr. Mo Sobhi Academy, which was a very good choice. As I mentioned, it helped me a lot to find my study partners, which were one of the most important parts in succeeding in this exam. To be honest, I can say they are the number one factor in succeeding this exam, because the way we pushed each other and the way we showed each other weakness and the way that we tried to improve each other is the cause that the three of us has passed the exam. So choose your study partners smartly, because they might be the cause of your success in this exam, or they might be the cause of your failing the exam, which is something that is unfortunate, and we do not want you to reach this. So, as I mentioned, the academy helped me to find my study partners, Dr. Muhammad, both of them, they are Dr. Muhammad, and I say hi from this video to them. And as I mentioned, the study partners are so important to have successful journey. The second step, which is after preparing to the exam, which, as I mentioned, took about 40 days from me. I was studying about 10 to 11 hours daily. My studying was kind of 5 hours of practice. The practice, as I mentioned, one of your study partners will be a role play, and you will be the doctor asking questions that's related to the scenario that will be written on the stem. And after that, the second 5 to 6 hours, I studied on my own. I studied the topics that are important, the GI topics, the obs and gynae topics, pediatrics topics. So the study to this exam should be two parts: practice, and also studying by your own to build up a knowledge that you can say while doing the practice. So this is the second important part in preparing for this exam. So let's speak about what to expect in the day of the examination. So I had my exam done in Hardman Square, which is in Manchester in the UK. And on the day of the examination, to be honest, I was not in my best conditions because, it's a kind of stressful situation, and the amount of time, money, and the obstacles that I faced through this journey, I was really worried about what's going to happen through this exam. But thanks God, I had a good exam, and everyone was friendly and welcoming, and the exam is a doable exam. You just need to have the confidence in yourself. You are a doctor, you have faced these situations multiple times in your work or in your study. So all is needed for this exam is to prepare mentally for this exam, because the confidence is very important in this exam, and the way you deal with the situations, and you show that you are a good doctor and a well-rounded doctor that can deal with any kind of situation, even an angry patient, even breaking bad news for patients. Whatever situation you face, you have to be confident in telling this situation and dealing with it. Whenever you have this kind of confidence, I assure you that you're going to pass this exam in good marks. So finally, in the end of the story and in the end of this journey, it's one of the milestones. It's a checkpoint that I have reached. I'm very grateful that I have reached this checkpoint. I hope everyone that is willing to do the PLAB to reach this kind of happiness that I'm living in the meantime. I hope that this video was helpful, and whenever and whatever question you have or any kind of help that anyone needs, I'm more than happy to help. As I mentioned, if anyone can do it, you can do it. It's just something mental. So never give up. Never think that you are not enough or you're not qualified to do anything, because as I mentioned, in this life, 99% of the victories and the success is done mentally. So never give up on yourself. Never feel that you are not confident in doing anything. Whenever you would like to have a goal, work as hard as you can and you will reach it. Thank you so much for listening to me. And I hope that in the future I share other successful stories and share medical knowledge that helps medical students and doctors. Thank you so much, and bye bye.